My name is Dennis. I'm a nurse practitioner student at Michigan State University, and I'm going to be demonstrating a head and neck examination. This is my patient, Mackenzie. First of all, I want to make sure that you sanitize your hands. Introduce yourself to your patient. Hi, Mackenzie. My name is Dennis. I'm a nurse practitioner student at Michigan State University. And as with any examination, you always want to begin with a general survey. What I'm doing there, I'm just going to be looking at facial expression, kind of the overall demeanor of the patient. I'm looking at the shape and build of a patient. I'm looking at how they're dressed. And most importantly, I'm looking to see if there's any acute distress or if they just look toxic or ill. And Mackenzie looks like she's doing okay. She's breathing well, and she has a generally cheerful demeanor. Looking at the head and neck, I'm going to inspect the head and neck. I'm going to come a little closer here, and in inspecting the head, I'm going to just palpate the scalp and just kind of be feeling the contours of the head. I'm feeling for any kind of nodules. I'm looking at the scalp. I'm looking for any redness or dandruff or anything of that nature. I'm looking at the distribution of the hair, and while I'm palpating, I'm feeling the hair for any brittleness or anything of that nature. And that all looks good. Then I'm going to look at her face. I'm looking for symmetry, looking at the general features, making sure there's no unusual features. The skin is intact, no abrasions or lesions, and that it's normal for her ethnicity. And then after inspection, I'm going to go ahead and begin with palpation. And with that, I'm just going to palpate the temporal arteries. Okay, and feeling the temporal arteries, what I'm feeling there for is symmetry. Is there any tenderness when I touch there? No. No tenderness. So I'm looking for symmetry. I'm looking for tenderness, and I'm looking for equality of the pulses. I'm also looking for any kind of thickening of the arteries. And while I'm there, I'm going to go ahead and palpate. Tell me if there's any tenderness. I'm palpating the frontal and maxillary sinuses. Any tenderness there? No? Good. I'm checking for tenderness or any kind of swelling of the sinuses. Then I'm going to begin just looking at the orbital area, the area of your eyes. So what I'm looking for here, I'm looking at the eyebrows, looking for normal hair distribution of the eyebrows. I'm looking at her eyelids, making sure that her eyes are opening and closing appropriately, that there's no swelling or edema of the eyelids, that the skin color is consistent with the rest of her face. I'm also looking at the eyelashes, making sure that they're present and have a normal distribution, which she does. And then I'm going to begin with palpation of I'm going to pull down, look at the conjunctiva, and in doing this, I'm looking for the color of the conjunctiva, and I'm looking for any discharge. I'm looking at the sclera. Should be nice and white. The conjunctiva is actually clear generally, so I can look at the wound bed of the palpebral conjunctiva. The bulbar conjunctiva is on the eye, and I should be able to see through it clearly to see the sclera, which I can. And then while I'm here, so now I'm going to look at her visual fields, which will be testing cranial nerve 2 or the optic nerve. And in order to do this, Kenzie, what I'm going to do is I'm going to test your peripheral vision using confrontation. And what I do is I kind of get kind of close to you, and I'm going to use my own peripheral vision to test yours. And so what I want you to do is just tell me when you see my fingers moving. You can either tell me or point to them. Good. Good. And I'm going to test all 4 quadrants. Good. Perfect. So she has good peripheral vision. I'm also going to want to test her visual acuity. And what I'm going to do in order to do this is I'm going to hold this about 14 inches away, and I want you to tell me what line you can see the clearest? Or see the last line that you can see clearly. Okay, can you read it to me?
LTFPH.
Perfect. And so that reads at a 20/20 vision. So that's perfect. So I've checked her visual fields, I've checked her visual acuity. Now I'm going to begin to just to look at the external eye, and the way that I'm going to do this, I'm just going to be shining a light into your eye and looking at the cornea, and looking for the clarity of the cornea, and looking at the iris, color and shape of the iris. There's no unusual features there. I'm also looking at the pupils, which her pupils are quite, they're about 8 to 10 centimeters, or 10 millimeters wide. So it should be fairly easy to see any movement of the pupils. So she's got good constriction, and I'm going to check both direct and consensual constriction of the pupils. Direct is when I shine the light on the left eye, that her left pupil will constrict, and when I shine it again on her left eye, that her right pupil is constricting at the same time. So that's direct, and I look at the right eye, and I see consensual constriction. Perfect. And I do the same on the right. I get direct and consensual. She has good pupillary response, both direct and consensual. I can also at this point check for accommodation, and in doing this I can do it by checking both her vision near and far, and when she looks at a distance her pupil should be wider, and then as she looks at something nearby it should constrict. So what I'm going to have you do is just look up there at the wall and look at something, and then I want you to look at my finger. Good. Yep. And as she moves from the wall to my finger, her pupils constrict appropriately. So she has good accommodation of the pupils. So I'm also going to check the extraocular motor movements. I'm going to do this using an H shape. So what I want you to do, Kenzie, is just follow my finger. So I'm going to come over, and then up, down, up. Just follow with your eyes. Perfect. Up, down. So her finger, and then I can also, I should come in just a little bit there to accommodate near vision. And so she does have good extraocular movement, and by looking at the extraocular movement, I'm also testing cranial nerves 3, 4, and 6, which are the ocular motor, the trochlear, and the abducens. And by testing the visual fields, I was testing the cranial nerve 2, or the optic nerve. So now I'm going to begin with the ophthalmoscopic examination. And in doing an ophthalmoscopic examination, I would normally darken the room. I'm not going to darken the room for the purposes of the video, so that we can see. I want to get her head kind of level with mine as much as possible. And I'm just going to have you, when I'm doing this examination, I'm just going to have you look at something on the wall, and just keep looking at that something on the wall in order to keep your eye as steady as possible. And so what I want to do, I want to kind of brace myself on her forehead with my thumb just over her eyebrow, and then I'm going to come at about a 15-degree angle, and I'm going to move until I see the red light reflex. I'm going to come into the eye. I'm going to kind of brace against her. I can move. Okay. Follow the veins in the back of her eye to the optic disc. I'm looking at the optic disc. I want you to look directly into the light. Okay, good. Okay. And that allows me to see the macula. So when I'm looking in there, I'm looking at the retina. I'm looking for any the color of the retina. I'm looking for any lesions. I'm looking at the characteristics of the vessels, and they kind of lead me to the optic disc. The optic disc should be kind of a pale yellow with crisp edges, which is what hers was, and then you can see the macula just by having them look. The macula is just a little bit more medial, kind of nasally, and so by looking in, that kind of arranges for me to be able to see that macula. And that concludes the examination of the eye. Next, we will begin to look at the ear. And as with all things examining in assessment, we're going to we're going to begin by inspection. So I'm looking at her ears, making sure that their placement is symmetrical. I'm looking at the external pinna and tragus, and I'm going to just palpate. And what I'm looking for there, is there any tenderness or anything? I'm going to tug a little bit. You always want to do a tug test before you do an otoscopic examination, so that you can ensure that there's nothing going on with the auditory canal before you put the otoscope into the ear. And I'm also looking for any nodules, any deformities, any unusual characteristics with the external ear, or any discharge from the ear, which I'm not seeing anything with her. So next I'm going to perform the otoscopic exam. I'm going to hold it kind of like a pencil, so that I can brace against her with my other fingers, and I'm going to turn the light on, and I'm going to just kind of pull up and back on the pinna. I'm going to insert the otoscope into the ear canal, looking at the ear canal as I go in. I get to the tympanic membrane, and I'm going to look at the landmarks, color, and the optic disc. I'm just going to squeeze a little in order to look for mobility. And when I'm looking at in there, I'm looking at the ear canal as I go in for any redness, any lesions. I'm looking at the cerumen accumulation. I'm looking for any signs of infection. Once I get in there and get to the tympanic membrane, I'm looking at the color. It should be a shiny silver or shiny gray, pearly gray. They usually describe it. And I'm looking at the underlying structures. I'm looking at the bony prominences. I'm looking at for the cone of light, and then just with a little puff of air, I'm looking for mobility, any movement. There should be just a little bit of movement of the tympanic membrane. Okay, so that, and then I want to also check her hearing. And the way I'm going to do that, I'm going to do it through 3 tests. The first test is the whisper test, and what I'm going to do is just occlude one ear, and what I'm going to do is whisper a 2-syllable word to you. I just want you to repeat it as long as you hear it. So I'm going to occlude one ear.
Apple.
Perfect. And then I'm going to come around to the other side and occlude that ear. Baseball.
Baseball.
Perfect. So she has good hearing via the whisper test. The next test that I'm going to do is the Weber test. With the Weber test, what I want you to do is I'm going to hit the tuning fork and get it going, and I'm going to place it on your forehead, and then I want you to tell me if you hear it in your right ear, your left ear, or both ears. You hear it mostly in this ear? Okay. Ideally, they should hear it in both ears. She has maybe a little bit of lateralization to the right, based upon the fact that she was hearing it mostly in the right. Then I'm going to do the Rhine test, which is I'm going to place the tuning fork on the bone just behind her ear, mastoid bone. what I want you to do is just tell me, you hear that okay?
Mhm.
Okay, I want you to tell me when you can not hear it anymore.
Yeah.
Can you hear that now?
Uh-huh.
Tell me when you cannot hear it anymore.
Yeah.
Okay, perfect. And then the Rhine test, you should be able to have a 2-to-1 conduction, air conduction to bone conduction. So AC is always greater than BC. And so those are the 3 hearing tests, and that concludes our examination of the ears. Now we're going to begin to look at the nose. As I look at her nose, I'm just going to look at the size, the shape, the symmetry of the nose. I also want to check the patency of the nares. Checking the patency, what I'm going to do is occlude one nair. And what I want you to do, Mackenzie, is just to take a breath in with the other nair. Okay, good. And then this side. Good, so both of her nares are patent, which is good to know before we begin to look into the nares. And to look into the nares, what I'm going to do is have you just tilt your head back a little bit. And I'm going to just, my non-dominant hand, just going to this back a little bit, holding the, I'm going to look into the, it always helps to turn the light on first. So I'm going to take a look. You should be able to see the inferior turbinate, see the septum, the vestibule, both. So in looking at the nose, what I'm looking at is I'm looking at the septum to make sure that it's midline and that there's no perforation or deviation of the septum, which she does not have. I'm looking at the, generally you can see the turbinate, sometimes the inferior turbinate, sometimes the middle turbinate, and they should be redder than the oropharynx, but shouldn't be enlarged or, and hers looked very good in the, and I can see she had good cilia on the vestibule as well. So that concludes my examination of her nose. So we've completed the head, the eyes, the ears, the nose. Now we're going to proceed on to the throat. So in doing that, I'm going to look at her lips. I'm going to just have you kind of pull your lip down. I'm just going to pull your lip down a little bit. Look at the gingiva. And I'm looking at her teeth. Can you open your mouth for me? Open wide. Okay. So I'm going to look around. I'm looking at her teeth, making sure that there are no obvious dental cavities, missing teeth. Looking at the mucosa, the buccal mucosa, the top of her roof of her mouth. Looking for any dental appliances, which she has braces and a dental appliance on the roof of her mouth as well. And I'm looking at the tongue, looking for any deviation of the tongue. You can stick your tongue out for me. Good. And move it from side to side. Good. Perfect. And then open your mouth wide. And say ah.
Ah.
Okay, good. And in doing that, I'm looking at the tongue. I'm looking for symmetry of the tongue. I'm looking for ease of movements of the tongue. I'm looking at the back of her throat, at the anterior posterior pillars. I'm looking at the tonsils. I'm looking at the uvula, and I'm just looking at the posterior pharynx for any redness, any erythema, any lesions, and your oropharynx looks really good. So the only thing I would note on her is that she does have braces and an oral appliance on the roof of her mouth. So that concludes the examination of her throat. So now I'm going to begin to look at the neck. So again, beginning with inspection, we're going to look at the neck. I'm going to look at the symmetry. I'm going to begin with inspection. And so I'm going to begin with looking at the symmetry of the neck, looking at the musculature, making sure that musculature is even, that there's no torticollis, looking for any jugular venous distension or any carotid pulsation that I can see. And on her, that all looks normal. I want to palpate the carotids. I'll begin here, slide down a little bit. And you only want to palpate one carotid at a time. You don't want to risk occluding both. And in palpating the carotids, I'm looking at the rhythm and the amplitude, and she's about a +2 and with a regular rhythm. And then I want to auscultate the carotids. And to do that, what I'm going to do is have you, Mackenzie, look over your left shoulder. And I'm just going to, okay, I'm going to have you hold your breath for a second. Good, okay, you can breathe. And then I'm going to have you look over your right shoulder. And hold your breath. Good. You can breathe again. And in doing that, I'm just listening, usually with the bell of a stethoscope, and I'm doing that to listen for any kind of unusual sounds or bruits, which would indicate that there's some maybe plaque or narrowing of the artery. Then I want to investigate the thyroid. I'm looking, I'm not seeing any kind of goiter. I prefer to use the examination from behind. So I'm going to come behind you, Mackenzie, and I'm going to reach around, and I'm just going to lightly push on your throat. And what I'm feeling for here is the cricoid cartilage. And then I'm going to come just below that, and I should be able to feel the isthmus of the thyroid. And then I'm going to have you swallow for me. Good. Perfect. And then I'm going to have you turn to your left. There you go. And just palpate a little deeper there. And then turn your head to the right. Okay, good. And doing that, I'm palpating the thyroid. I'm looking to make sure that the thyroid is soft, that it's mobile, it should easily move underneath my fingertips, that there's no enlargement or nodules that I can palpate on her thyroid, which I cannot. And then the last thing on the neck that I want to do is palpate her lymph nodes, and I'm going to be looking at the 10 lymph node chains. I'm going to begin with the preauricular, which means before the ears, pre and auricular, post-auricular, and the occipital, and then the tonsillar, submandibular, and submental. And then I'm going to anterior cervical chain, posterior cervical chain, the supraclavicular, and the infraclavicular. Okay. And I'm not feeling any enlargement of the lymph nodes. And in looking at the lymph nodes, what I'm looking for is whether or not I can palpate them, if there's any tenderness. Is there any tenderness, Mackenzie? No tenderness. And I'm looking, if I can feel them, I'm looking for mobility, and then they should be soft and not hard or nodulous. And so that concludes the examination of her head and neck. And I want to just report my findings to my patient. So everything looked normal. The only thing that I would note on her is that she did have some right lateralization of her hearing test, and that she does have some dental appliances, braces, and an appliance in the roof of her mouth. And then I would simply wash my hands and conclude the examination. Thank you very much.